It might be something that you might want to think about in your facilities. Depression can be very physical. It can be as physical in causes as a broken leg. And even though there's no single cause, it's often multi-causal. Some things that we know are related to depression are the following. Abnormal sleep patterns, a lot of disruption in sleep, too much or too little. Neurotransmission dysregulation, in particular, for example, serotonin, one of the neurotransmitters. Another is an abnormal thyroid-releasing hormone, and that often plays a very key role in depression. And yet another is an abnormal dexamethasone suppression test, which looks at the adrenal function and also increased cortisol. So you can see that we have quite a hormonal causative triangle here, you might say, as we look at the physiological aspects of depression. In addition, we're finding out so much more about nutrient depletion related to depression, imbalances in macronutrients, the simple sugars, and a lot is coming out about the effect of sugar as it relates to compromising our immune system, which then cascades us into many types of illnesses. Caffeine and alcohol also have been related to causes of depression. Since this conference is about imaging, I'm trying to present to you images here, and therefore some of the pictures that you see. I want you to just look at this in terms of images that manifest depression, and I'll point out to some of the significance of these pictures. In the middle of the slide, you see this man with a very dejected-looking face. One might imagine that he's sensing hopelessness, purposelessness, meaninglessness, that he doesn't feel a sense of significance or strength. To the left, my left, your right, I guess it's to the left, right, you'll see some food there, and this represents a manifestation that has to do with nutrition, that some people want to eat too much when they're depressed. Many of our elderly people refuse to eat. Might be a sign of depression. So attending to altered nutrition. Likewise with sleep, maybe people want to sleep all the time, or they might also have an agitated depression where they're not able to sleep. And then up at the top we have a stop sign, because safety is a key thing with depression, and I'll be addressing that. Certainly a safe environment is important for all of our patients, but I also want to address safety from self-harm, which is critical when we're talking about caring for depression. And then in terms of activity, activity is another key aspect that manifests itself through depression, too much or too little. And just remember that you can have agitated depressions also. So first, focusing on meaninglessness, purposelessness, and hopelessness. According to Mazzaro, who's one of the authors I really like, he says that our deepest need is to create meaning in our experiences. And often we have these hierarchy of needs, but a key thing that keeps us alive and vital in life is to make some sense of our experiences. And a new book that's come out recently by Perlmutter and Villaldo talks about insignificance. And in this book, the authors interviewed elderly people, and they asked them, what do you fear most? What do you fear most? The third most feared thing was death. And the authors really expected it was going to be the first, but it was third. It was down on the list. The second thing that elderly feared most was adequate financial resources to care for themselves in their later life. And the first most feared thing was feeling insignificant. So I think that this says something about the value that elderly might feel in terms of their purpose, their meaning in life. It's very fearful for them to feel a sense of insignificance. The meaning, the meaninglessness, purposelessness, insignificance can be fatal. And we know that elderly have a very high suicide risk. In fact, they are the fastest growing population for suicide in our country. They've experienced multiple losses in many ways. They're many times reluctant to seek help, and I find in the rural area, with their value of rugged individualism, their struggle to maintain their dignity with autonomy, that this is often very challenging for them to reach out to seek help. We also know that their attempts for suicide are very serious, that 1 in 4 attempts in an elderly person results in a suicide death. 1 in 4 attempts. So when they are harming themselves, they have a real serious intent to make it serious. We also know that the presence of medical disorders increases the risk factors for suicide. What about Montana? Those were some national things. Montana, we have some real issues with suicide in the elderly. Our statistics, and again I refer you to our Department of Vital Statistics, from last year showed that we had 202 suicide deaths, a total. But look at these numbers in terms of those that were over 55. 23% of them were in 55 to 64-year-olds, and 16% were in 65 to 85 and above. 39% of all of our suicides in Montana are in people over the age of 55. I find that quite astonishing. And perhaps you already know Montana is second highest in our suicide rates in the United States. We seem to maintain that status in the top 2, 3, 4, 5 for many years. And that's not just unique to Montana. Other rural states kind of join us in that figure. Alaska's #1, Montana's #2, Wyoming's #3. There's something about the top 10 suicide rates occurring in the western states, also in rural states. So this is something very important to pay attention to. I think when people are in deep depression, they are in deep suffering. And we heard a little bit about suffering in the presentation from Dr. Eaton. I thought that was very helpful to help us focus on suffering as encompassing the whole person. And throughout time, if you look at the ancient traditional writings from Greek times, for example, what we see themes over and over again in literature and research are 2 major themes about the experience of suffering. And one of those is voicelessness, and the second is alienation. So many times people who are in deep suffering, and if this is about depression, it's deep depression, I believe those people suffer greatly. They can't tell you about it. They cannot often express. Janice Morris talks about silent suffering or voiceless suffering. And so it's so deep that there are words that are not available or not adequate to truly express their suffering. And secondly, the alienation. These people feel alienated from themselves, from their families, from their life, their values, their environment. They just feel very, very alone and very isolated. And so keep in mind that if you're dealing with somebody who's in a deep depression, or even many times moderate depressions, people can feel this way, that oftentimes it's voicelessness and it's alienation that are part of their experience. And I'd like to just go to our responses then to suffering. What do we do when somebody is in such a deep situation? Our responses then need to focus on regaining voice and restoring relationship. And there's many communication approaches in terms of empathizing with our patients, really listening to them, really listening to their families, because often they're suffering too, and really trying to focus on the person and their experience. I'd like to just point out a few things about restoring relationship. This too was mentioned by Dr. Eaton and Dr. Kane about the connectedness being so important. And our research is really showing that we really need to focus on connectedness and relationship with people. It is healing, it is health, it is vital. Several years ago, about 10 years ago, I heard Dr. Putnam speak. Dr. Putnam is a professor at Harvard, and he wrote a groundbreaking book about 10 years ago called Bowling Alone: The Collapse and Revival of American Community. He actually spoke at my son's orientation when he was starting college, and I went to hear them. It was quite revealing. But he said and he had like 500,000 pieces of data and interviews that he had done over several decades in looking at what had happened in the United States to people's connectedness. And he found that we weren't going on picnics, we were disconnecting with family, we were not as connected with neighbors, we didn't even know who our neighbors were. And he said that this is our social capital, and it's severely declining. It's the very fabric of who we are as human beings, and we need to pay attention to us. And if you think 100, 120, 30 years ago of the social fabric, people got together for, in the rural areas for quilting bees and harvest bees and whatever other kind of things. People were joining organizations, and we've had a major decrease in the people who are really committed to joining our organizations and really being a part of something in their community. And Dr. Putnam called his book Bowling Alone because what he was very astonished by is that some people were still going bowling, but they were not belonging to leagues. They would not be part of committing to a team league, to their bowling. But that was quite an awakening for me, and this is quite groundbreaking because since that time we've seen several other books and a lot of research coming out that is really focusing on the social relationship aspects of health and healing. Dr. Stephen Illiard, who's at the University of Kansas in clinical psychology, he has really dedicated his life to looking at depression and to what we can do about it. And he's written a recent book in 2010 called The Depression Cure. The Depression Cure, that's interesting. Do you think we can cure depression? But he sheds light on this predicament and the statistics that is projected that 1 in 4 Americans will suffer major depression sometime in their lifeline. 1 in 4. That to me is staggering. Dr. Illiard has been inspired by the extraordinary resilience of Aborigine people, especially those in Papua New Guinea, who do not experience depression. Isn't that interesting? At least from what we know. It's very, very rare in their society. And Dr. Illiard reminds us that our bodies were never designed for sleep-deprived, poorly nourished, frenzied pace of the 21st century. Does that sound familiar to many of us? It does. Sounds like nursing too, doesn't it? But he prescribes an easy-to-follow, clinically proven program that really harks back to what our bodies were originally designed for. And that is an omega-3 rich diet, exercise, plenty of natural light, ample sleep, social connections, participation in meaningful tasks that leave little time for negative thoughts. Sounds like some basic healthcare things, doesn't it? Anyway, I'd like to just read what he has written, a quote from his book, as he writes, "Social interactions have profound physiological benefits from reduced risk of depression to enhanced immunological function. The link goes back to our ancestors for whom social isolation was physically dangerous. The advantages of social support remain today. Levels of the toxic stress hormone cortisol drop precipitously when we find ourselves in the company of friends and loved ones. If you factor in the physical touch of a friend, you also experience increased activity of dopamine and oxytocin, the feel-good brain chemicals. Consistently high levels of stress promote inflammation and are associated with shrinkage of the brain's memory centers and the frontal cortex, which is the seat of abstract reasoning." It's pretty profound, isn't it, when we realize, the power of healing that we have just with our presence and with healing touch. It's pretty exciting to think that within our realm, we're always on the threshold of fostering some healing in somebody else.